takele hu wangu Longpang Pongdo Dingbu Sholem Bo He Wangu Longpang Lugong Dike Umbe
House of Hope, in a sense, I feel the name emerge out of, an era where every third family had a drug addict or someone in the family who was into drug abuse. But later on, the organization began to feel that unless primary health is focused on, then you really can't address other larger issues like HIV. Secondly, when we went into the villages, we found that simple diseases or simple ailments or deformities were things which could be easily corrected, and yet this became impediments. The only option for the organization was to bring professionals into House of Hope, and the person who really played the catalytic role was Dr. Robin and Dr. Laji.
I need to think about what to do with it. We can't see the stone, but her pipe is blocked. I come to Tuensang because I believe that the people here are unnecessarily suffering. We have powers, we have people in connection here, there. So you really don't want to go to the needy place.
Where there's absolutely no presence of infrastructure or equipment, it really required surgeons who are not the normal surgeons, who were extraordinary, one of a kind within the fraternity. And so these are people who said, okay, even with torchlight we can conduct the surgery.
Yeah, I think we finished seven major surgeries.
I see.
We had a lady with a big thyroid. We had someone with kidney stones, 3 gallbladders, a baby. Yeah, it all went okay so far. Good.
Good.
We have some more to do, 4 more to do in the afternoon.
They pack their things, they leave their clinics, they leave their profession, and without even being paid a pie, they come here, twice a year they come and sacrifice, and that's really amazing.
I happen to be introduced to this place, and I think there are wonderful people here. Even if we come as a team, it's not just me, I think it's our team. I don't think one person can actually give much, but together I think we can give a lot.
We've known Dr. Laji and Dr. Sheila for many years. Laji's talked about the camps that he's done around the country, but we've never been to one. We weren't quite sure what a surgical camp is, so we decided we would come to find out more about Nagaland, and we've never heard of it before.
House of Hope is basically very basic. It's just, there's a ultrasound machine, there's a few equipments, some basic OT equipments.
After the thyroid, we give this one.
Take it.
And this lady is admitted, na?
Yes, she is.
Okay.
Whenever such camps happen, we have had to convert our little prayer room, fumigate the whole room, sanitize the whole thing, and use it every morning for the surgeries.
Find this little operating theatre in the chapel of the medical centre here, the care centre, and lots of rusty trolleys and old beds and a little bit of equipment, and people doing fantastic stuff with the local folk who don't have any other surgical care.
Or if it's not an obstructed one, the nurses can do it.
In the first year, we in fact conducted around 170 surgeries without even using a vial, a unit of blood, during the surgery which was being done.
In some places, there are no blood facilities. Does it mean that patients should die because there's no blood bank? Some places where I work for 300-400 kilometers, there's no other healthcare facilities. City hospitals are going to cost a lot of money, and people don't have the money to go to a bigger center. So I think we have to evolve a system. There's aorta. Okay? This is inferior vena cava.
Yes.
Okay, they are together. Okay.
Yes, sir.
So from the aorta, you have the renal artery coming that way. Inferior vena cava comes there. Okay.
Yes, sir.
Now that is your kidney.
Yes, sir.
Okay, this is anterior.
Anterior.
At the back, you have the pelvis,
Okay,
coming
with the
down.
urethra.
Okay. So when we operate from behind, we are at the back, straight on the thing without the vessels.
I understand, sir.
Understand now? Even our training needs to change. We can't have so many specialists in a rural place. So we need a separate training for those who are willing to go to rural India. We need special funds to encourage these people to go, have mobile teams, camps, and give more freedom instead of tying their hands.
Natali question na 3 bar 4 bar. Gola 3 Natali di. Kini ka site? Bishi.
Yeah, leave it open.
So a little bit of complaint on difficulty in swallowing, maybe.
Yeah, they all have it. She doesn't have any bone this much. So our plan is to do bone grafting and break this bone, get the leg straight. So I think it will take repeated surgery, but she should be able to walk normally. Yeah, I think by the time she's about 20, she should be a new woman.
It's because of the success of the earlier camps, where there has been absolutely 100% recovery rates, that we are beginning to see that people from far off places come here.
Some put lipstick in the morning. They all put lipstick.
Yeah, they put lipstick. They're feeling much better soon.
After lipstick. Yeah.
Balas ka ba?
You also put lipstick.
And so, which was just around the Chang area, we began to see that the Konyaks were coming. And despite the conflict between Changs and Konyak, you find that Konyak just came in. And it began to build a bridge between the tribes. So I guess this whole camp concept is taking a very different dimension, and it's beginning to impact lives, and it's bringing in a lot of confidence that there is hope.
What are you saying?
I think helping others should be the highest joyful experience. It makes me richer as a person.
Because we have material wealth doesn't make us any better or more sophisticated in our feelings and our emotions and our needs. And I think when you get closer to people in their very meagre living conditions, you can see they are just the same as you.
To me, a patriot is the person who loves the people of the country, not one who just protect the border or dying for some ridiculous reason. But those who love the people of this nation and serve them, they are the true patriots. And I think we all can become that.
Oh, 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 chế nhì à san yok lo chế nhì à ô nâu nhì à chẳng sang chẳng ma nhì bơ si gu ma lo tang dang y yo chẳng sang chẳng ma lấy cả cha chăm lâm tô bông như mong sớm cái lo